The nurses have got the Tories on the run. According to some news reports, which have just come out today, Steve Barclay, the health secretary, thinks he's going to have to give some ground on pay because of the strikes, which have the overwhelming support, of course, of the NHS's staff. Now, I went on the Jamie Ryan show, and I said they shouldn't just concede to them, they should grovel.
The nurses just do the most incredible job and do need to be recognised for the effort that they put in and the empathy that they show to so many people, including people that we know. But there is only a finite pot of money. And what's really interesting is that Stephen Barclay, even though he is privately talking about this, and it's interesting that it's private, but it's been leaked, so it's almost as if it's a kite flying exercise to see how it would go down. He doesn't actually say, yes, you can just have the money. He's saying you can have the money, but I'm probably going to have to take that from your budget and there will have to be cuts to services elsewhere. And at the moment, we already know that A&E is overstretched. We know that ambulance drivers are frustrated that they can't leave their patients in the hospital because there aren't enough beds. There's such a creaking service. But there has been an awful lot of investment in the NHS. And in effect, what the government is saying is, unfortunately, there isn't a limitless supply of money. So if you do want the money, there are going to have to be changes made elsewhere.
The idea of cuts in service will worry people at home, Owen, won't it?
Which is why the NHS budget needs to be increased. I mean, these are about choices. I mean, by the way, they shouldn't just back down. I think they should get on their hands and knees and grovel to the nurses. The issue of pay is not just a moral one. There is a moral question about the nurses who carried this country through the worst crisis since World War II, who were clapped by politicians who then imposed real terms pay cuts on them. That's a moral question. Should we treat nurses with that much contempt when we depend on them to save our lives, to look after us in our often most difficult moments? It's a practical question, which is there is now nearly 50,000 nursing vacancies in England alone. There's a problem with retention and recruitment, and that's because being a nurse, nurses aren't heroes, they're often called heroes, they're professionals. And they're professionals who aren't being paid properly for a difficult job, which means people are deterred from becoming nurses, and morale is so low that we're losing nurses as well. In the moment, this country, I don't think people realise this, is in the midst of a humanitarian crisis. 50,000 excess deaths last year. And we've had now, 170,000 excess deaths in England and Wales alone since the pandemic began. I was speaking to mortuaries and funeral homes this week. They said that, I'm just sorry to be macabre, they're brimming with corpses. They're having to put coffins in office rooms in funeral homes because there isn't any space. And that one of the main reasons for that is a crisis in the NHS. And one of the big problems with the crisis in the NHS is we don't have enough staff.
But what would you
not just wage?
What would you say to Wes Streeting from the Labour Party, who has said that actually we need to start having some really difficult conversations about the NHS? That actually, he said, I would not be able to offer the amount of money that the nursing union is currently asking for. I would have to say to them, there just isn't that money.
It's lucky that it's lucky quickly I'm an independent voice, because Wes Streeting's position is completely and utterly unacceptable. He's also in La La Land because he says that one of the ways we're going to solve the crisis is by using private hospitals. Private hospitals don't have any staff of their own. They just borrow NHS staff in their overtime. So the problem is, look, the issue is about priorities here. You could tax people who are doing well at the moment. You could tax the top 5% of earners, people earning over 80 grand a year more. You could ask, we had a record number of billionaires created during the pandemic. You could get them to pay more money. You could apply a wealth tax. And the question you have to ask ourselves as a society is, what is more important? A functioning healthcare system. Sorry, just to be very clear about this, we don't have that at the moment. We're a rich country, one of the richest countries on earth. We don't have a functioning healthcare system. Do not become ill at the moment, because if you become ill, there is a good chance you can't access healthcare. Now, we either say the rights of billionaires and people who are doing well, the top 5%, that is more important than people dying. And I don't agree, and that's why we need to tax them to increase the NHS.
It is wages that we need to focus on, because I was speaking to a lady yesterday on the phones, and her daughter was a junior doctor up in Scotland, and she said that the wages wouldn't be her first focus, that there were other things, just working conditions. So she mentioned canteens, a good functioning canteen, so nurses and doctors are getting nutritious food, free parking so that they can actually get to work for a reasonable wage. And also the education is so expensive to become a doctor or a nurse that if we subsidise that, which I think they are slightly subsidised.
No, but it's not either or. These are all absolutely. These are. I mean, look. Partly this is partly privatisation of the NHS because they do things like they outsource things like canteens to companies that then provide rubbish food for the staff. Look, it's not either or.
But that's about saying we're going to ask the NHS to deal with what it can do, and we'll outsource the thing. Why should you actually get an NHS provider to deal with the food? But you need a caterer to deal with the food. That's not about privatisation.
No. That's.
But the key thing is that Wes Streeting might be an outrider within the Labour Party saying what he's saying, but he is at least brave enough to say that the entire model isn't working, and therefore just to give the nurses a pay rise now doesn't actually change some of the systemic problems within the NHS.
Whatever my problems with New Labour's record in power, which I have huge problems with because they started increasing privatisation in the NHS, if you look at a graph of waiting times in the NHS, when Labour came to power in 1997, the graph goes like this. Do you know what happens in 2010? The graph goes like this. Why did that happen? Because they cut funding to the NHS. The model of the NHS, which is run by the public and is free at the point of use, is a good model and it works. What doesn't work is if you starve the NHS of cash when you've got an ageing population. Never mind if you throw a pandemic at that situation. And what we need to do is increase resources, because when Labour did that, even though they undermined it by increasing privatisation, waiting lists go down because you've got more staff, you've got more resources. It's not rocket science.
But there is a fundamental problem that actually, when you say it's a model that works, it actually doesn't, because if it really did work, other countries around the world would have copied it. Absolutely no country has copied our model of the NHS, so free at the point of delivery for absolutely everybody. It just doesn't work.
Hold on. Other countries, you're right, every country has a different healthcare system, essentially. That's true.
Yeah, which I always find a bit strange. Surely somebody in government somewhere would say they're doing a brilliant job in France or Sweden or Taiwan.
All I'm saying is every country has their homegrown system. A National Health Service, our National Health Service, the reason it has so much pride in this country, Nigel Lawson, the former Tory Chancellor, said it was the closest the English had to a religion, is because it does work on every outcome, almost. What it doesn't work, look, it's not, again, it's a very basic point. If you have a public service and you spend less money on it, then the service declines. That's what's happened to the consumer. It's not because we haven't privatised it enough that isn't working.
Now you see where that discussion was going. Lucy Beresford, who I like, by the way, she's honest about her opinions, but she's clearly talking there about moving the discussion over to privatising the NHS, in ending the old model of the National Health Service. That's what Labour have opened as a discussion by Wes Streeting talking about increasing the role of the private sector and changing the model of the NHS. That's emboldened those who want to abolish the form that the NHS currently takes. Alarming. What we need to do, of course, is save the NHS by bringing it entirely under public control, always reforming it to meet the needs of the population, but putting enough resources in and paying our staff properly so they can do their job. That's what works. Please like, subscribe. I'll see you in a bit.